helping make your life easier. Moms Every Day.
Good afternoon, everyone. We're glad you're here joining us for Moms Every Day. We're here today with Dr. Nihar Shah, and we're talking about a procedure, and it's called TIF, T-I-F. So what is TIF?
So TIF means transoral incisionless fundoplication. It is one of the procedure which is minimally invasive, and it is there for the treatment of the acid reflux. And it is incisionless, and it is done through the mouth.
Okay, and how is it performed?
So it is performed through the mouth. It is performed under general anesthesia. So basically we use an endoscope and a device which is called esophagus. We insert that from the mouth, go down where the wall is at the junction of the lower part of the esophagus and upper part of the stomach. And through that device we deploy suture material and reconstruct that wall so that the people do not have the acid reflux. It takes around 30 to 60 minutes.
So, I mean, a very short procedure time.
Right, yeah.
And what are the benefits of this as opposed to another surgery that you may perform?
Right. So basically, this is done through the endoscopy, and it is minimally invasive, so it is not a surgery. And the good thing is, there is no alteration in the anatomy. And, because it's not a surgery, there are no scars, so less post-operative pain, less post-operative discomfort, and the recovery is much more faster. Many of the time it can be done just as a same-day procedure where the patient can come in, get the procedure done, go home. And has excellent side effect and a safety profile. Any major side effect is less than 1%.
Wow. Now talk to us about the data from this. What does the data show about the TIF procedure?
Right. So there are a lot of studies done. Altogether, total 18,000 procedures has been done. There are 4 randomized controlled trials have been done so far. So the initial trial showed that, the success rate means that at least 75 to 80% of the people had resolution of the acid reflux symptoms.
Wow.
And the latest trial, it's a tempo trial, which has shown that 91% of the patient had significant improvement in the symptom, and it even lasted after 3 years of the procedure. And 87% of those patients has resolution of the esophagitis.
Wow. Now talk to us about some of the side effects with this procedure.
Right.
What are some of them?
So this is like a very safe procedure. The side effect profile is, very, it's excellent. And there are some people who have a little bit of, I would say, throat discomfort and a sore throat after the procedure, and some people might have some shoulder pain and some chest discomfort, but generally it goes away in a day or 2.
And you said too that this is pretty good compared to the other surgeries you do, because there really aren't a lot of side effects with this.
Right. Yeah. So I mean, as compared to the other surgery, if they undergo the surgery for the reflux, many people have trouble swallowing. So most of the people after TIF procedure do not have that bothersome trouble swallowing or a gas bloat syndrome. So that's another advantage.
Oh, that's great. And talk to us too about what your patients can expect after they have this procedure done.
Right. So mostly, right after they have the procedure done, if they feel fine, we let them go home on the same day. We put them on the liquid diet for first 2 weeks, and after 2 weeks we would transition that diet to, I would say, a little bit of soft diet for another 2 weeks, and after 4 weeks we generally start them slowly on the regular diet, and around 5 to 6 weeks where they can go back to completely normal diet.
Okay. And Dr. Shah, too, if someone is interested in this and they want to call and schedule an appointment with you, or want to check out and see if they are a candidate for this procedure, what are some ways they could do that?
Sure. I mean, they can call our office. Number is 304-691-1000. I would generally like to see them in the office first, go over their symptoms, and see what else is going on. If anything else needs to be done before we can consider them for the treatment. And so, I mean, initially it would be like an office visit, and after that we would kind of decide that if this is the right procedure for them or not.
Certainly. Well, Dr. Shah, we appreciate you joining us to talk with us about this procedure today. If you all at home would like more information, you can head over to WSAZ Mobile or WSAZ.com. All you have to do is click on the Moms Everyday tab. We'll have this interview listed for you there with all of Dr. Shah's information, as well as all the information on the TIF procedure. Thanks so much again for joining us today, everyone. Have a great day.